I think we can start, since this is the last time we see each other before the group work presentation. Some of you had asked me about the structure of the group work. I remember you that you have to present, and then you have to prepare an outline, well, describe sort of a detailed outline of the presentation in the form of, let's call it a paper, but it's not like a proper paper, okay? The objective should be the analysis of the development of a new service or of an innovative service. Just to be clear, this can be a service which is already in place, or it can be just your idea about the development of a new service starting from what's there in the market. The structure provides the characteristics of the new service. In doing so, you should try to exploit the theoretical framework which has been extensively discussed during the course. So what kind of service we're talking about, what kind of innovation can we think of when describing this particular service, what are the characteristics of the sector in which the service has been developed. This is linked to the second point, which involves the description of the sectoral competitive environment. Remember the very first lectures that we had, we were discussing the technological trajectory. So in which kind of path did firm develop this particular service or this group of services? I know that some of you are actually dealing with more than one service. What are the sources of technology, or better to say of innovations? Size of the firms, number of firms. Is this a very competitive sector? Is this a sector which, I don't know, is an oligopoly, a monopoly? What are the implications of this? User needs, okay? So the idea of price versus performance sensitive users, just to make it very short, means of appropriations, if any. Okay, so we've been extensively discussed the fact that in services, most companies do not actually use patents as a mean of appropriation, but for some particular sectors, knowledge-intensive business services, banking and insurance to some extent, how can firms appropriate the results of the innovation that you are discussing, so in your specific case, okay? And then, of course, we're talking about services, so what are the demand characteristics? Diffusion rate or potential diffusion, again, think that you have to provide like a business plan if the service is not in place. So what could be the market for that service? Not only in terms of numbers, but also in terms of service characteristics. So for example, consumers versus business users, but this is just an example. Are users actually involved in the production, distribution of the service or not? So do actually users participate to the production? We've been talked a lot about the co-production, the fact that the services are at the same time produced and consumed, but of course this applies to different extent to different kind of services. Okay, so think of what we've discussed during the course and think of how you can apply the framework to the case that you want to investigate. Of course, you do not have to take the theoretical framework in its entire, let's say, structure and apply it, okay? So, for example, your innovation might be, I don't know, a radical innovation, that's it. You don't have to take into account all the possible forms of innovation that have been developed from a theoretical point of view, okay? So just try to be focused, try to understand how you can exploit what we've discussed in order to better characterize the service, okay? And finally, be critical. Right? So don't just describe the service, the features and whatever, but try to be a bit critical in the analysis. So try to understand what are the strengths and weaknesses of the service, both if the service is already in place and is successful, for example, or if the service is not in place and you're putting yourself in the hand of a firm who wants to develop the service. Okay? This is the group division. Any question on this? The deadline for handing in the paper, let's call it like this, is on the first date of the exam. Formally, you can send it to me via email. You don't need to print it out, of course. If you manage to do so, please send me the slides of your presentation in advance. That's not compulsory. It helps, but I mean, I can understand that if you're working on it at night, then just don't worry about it, okay? So The last case that I want to discuss with you is a very particular case of service, and this is why I decided to put this into perspective. And it is a very particular case of services because we're talking about hospitals, okay, and about healthcare services in general. Now, why I think this is a very important case to discuss, of course, this falls in the aim of public services, if you want. The hospitals were born as public and then are sort of slowly going toward more private organization. But why is this particular case very interesting to investigate? Well, first of all, because really hospitals and healthcare organization in general have some features that make them really not comparable with other type of services. There are some features that we've seen common in different type of services, although we've stressed a lot the heterogeneity of services. We said that you cannot really compare a bank with a company providing touristic services, okay? We cannot compare a KIBS company with a company offering mobile communication services, but still some features are there. Okay, so the importance of users' needs, the fact that users are actually involved somehow in the co-production, or at least as a passive source of information, the case of mobile communication, just to remember that. The fact that most of the services that we've investigated have been strongly affected by the development of ICT. Okay? And the idea is that ICT, in most of the cases we've seen, was used to increase efficiency in the first place, and then also as a means of developing new products and new services. Okay? And also, in most of these sectors, we saw that there is some sort of imitations, but companies are trying actually to develop specificities that make them services not comparable with other companies' services. Okay? So the standardization is there, but is there more as a means of offering a basic services. When it comes to very advanced or very sophisticated services, customization is actually what makes companies very competitive in the market. What about hospitals? What do you think that are the most important characteristics that really differentiate hospitals from other companies in the market, other service providers? Think of these services being users. Okay, so you're users and you want to exploit these services. What are the differences between this and banking or mobile communication services or tourism, for example, which is also a case of personal service, right? Yeah.
Users are less sensitive to price, maybe, because it's an important asset for you.
So users are less sensitive to prices.
And then also the public contribution has an important place, since the service is not, at least in our system, is not covered just by the user.
Okay, there is a role for the public sector. This is somehow related to the fact that users are not very sensitive to prices. So if you let these particular companies rule in the market without any control, okay, or if you do not fund somehow the users, this might be a problem in this particular context. Okay, Sebastiano, you had other ideas on?
Probably data sensitivity, the relevance of personal information privacy policies are similar to banking, perhaps.
Okay, so okay. Data are very sensitive. Okay, other ideas? Well, you've more or less tackled the relevant issues here. Well, let's start by saying that hospitals were born, at least, as public services, okay? And this, of course, calls for a very important role of the public sector, not only in funding the users, but also in getting into the production and the delivery of health services. Okay, and this, of course, has a number of implications, also, not only, but also in terms of efficiency. So the idea, the general idea is that health services are public goods, and since public goods are subject to some inefficiencies, if the production is left to the private sector, then the public sector intervenes. The issue is very complicated, okay, and as you might know, most hospitals right now, even in Italy, are private, which means that they are managed as private organizations, okay, although they still receive some funds from the government. So even in countries where we do have a public health system, a social welfare which includes health services, okay, differently from the US, for example, maybe also the US are changing, these service providers somehow are public, okay? Second very important point, and this is more from our perspective. So from the perspective of, if you want, sector analysts, from the perspective of someone who's interested in studying the sector. Okay? This is really a case where innovation has been extensively measured, monitored, controlled. Okay? So I started the whole course of innovation in services, and this is why I like to finish this with this case, by saying that services has been very often neglected, that innovation in services is very difficult to measure, and this is why most of researchers have really not paid too much attention to innovation in services. This is a very big exception. Okay? Now we'll try to understand what is innovation in this particular case, but hospitals have been for sure extensively monitored, okay, both at the level of research, at the level of policy, of course, being public organization, and at the level also of the users. So even the users pay lots of attention to this particular sector and to the type of innovative services that are being developed in this context, okay? So this is not really a sector where innovation doesn't matter, and that's all common to other sectors, but it is a sector where innovation matters very much and where innovation has been extensively monitored. The second reason why services have not been extensively analyzed by research and policymakers is that, you remember, very often services were considered as a residual in the economy, something which was not really interesting, something which was not really productive. Back to Adam Smith, the idea that, you know, services are the work of civil servants, artists, and whatever. Really nobody questioned hospitals' usefulness from a social perspective and also, of course, from an economic perspective. They have prestige, they have symbolic importance. They are actually evaluated in terms of their capacity to innovate. So these are important actors in the economy. And these fall really in the realm of public services. So if you go and look at the sectoral classification of different industries, the health services fall within the public service environment, which is a specific sector in which we also find education and other type of services. Okay. The problem with the analysis of innovation in this particular sector is that what captured the attention of researchers and policymakers very often was the medical innovation. So what most people were interested in while studying innovation in hospitals and healthcare systems, so I will talk about hospitals, but I mean, try to imagine the all components of the big healthcare system, people were looking at medical innovation, okay? And what people often talk about when discussing, you know, the technological trajectory in this particular field, they talk about biology. They talk about the development of new drugs. They talk about the development of new surgical procedures, for example, and so on, okay? Innovation of other type, including organizational innovation, which has played a major role in all countries, is not usually considered as an interesting case. So hospitals are actually interesting both for policymakers and for researchers, and this is very different from any other kind of service we've seen. Innovation is monitored, but commonly to what we've seen for other sectors, the idea of innovation is quite limited. Okay? So let's look at how the health system actually provides new services by looking at medical innovation, which means drugs on the one hand and different kind of procedures that take place in the hospitals, in the medical part of the hospital on the other hand. Okay? What kind of innovation you would think of aside of new drugs or aside of the development of new, for example, surgical procedures in hospital? What do you think has happened in hospitals over the past 30, 40 years? Yeah?
Process innovation, the way you actually get the customer around, getting it to
okay.
How you move the sick patient around, basically, in order to...
Okay, so let's call it process innovation. Now, we will try to be a bit more detailed on this. But the idea is, I like your expression of how you move the user around.
So what they do now is that they actually classify people when they get in. Like you get a red tag if you're really sick, and you get a blue tag if you're not that sick, and if you have a blue tag, you wait forever.
Okay, so user, let's say classification, and also management. What else? Yeah.
Yeah, as he was saying, for sure, and not only at the reception, but then also through the operation process and whatever, you have some standard rules which were set and which are followed. Basically, also taking them from the racing world.
Yeah.
And also, it's not only on the moment when the customer
Yes.
is at the hospital, but there's an extension of post hospitalization and also lifelong distribution of the service actually. So the hospital knows your story first, is supposed to know your story.
Yeah, which raises some issues, of course, of privacy. Okay, so the idea is that there is really a big development, of course, in the process innovation area and in the pre-post service assistance, if you want. Okay, so the idea is that if you get into a hospital and get any sort of medication or a surgical operation, the relationship between the service provider and the user does not end at the moment when the operation is over, but involves a pre-screening of the patient, very often through some IT means, and involves some post-sale assistance, if you want, once the user gets home. Okay, so this is a very important point. And also, of course, the amount of data which is available to the service providers is increasing over time, and this has to do mostly with the development of the so-called electronic medical recording, okay, so EMR, which is a form of process innovation which allows basically to elaborate data more quickly, exactly in the same way in which banks, for example, have used the IT systems. Okay? The literature of innovation in hospitals is quite extensive, probably differently from what you might imagine, and has 4 different areas. One, very basic one, of course, very economic style of analysis, sees hospitals as a production function. Okay, so a firm can be described by its production function, and hospitals do not make any exception to that. The second and very extensive branch of the literature is trying to focus the attention on the development of technological and biopharmacological capabilities. Third, this is a more recent approach to the development of innovation in hospital and has to do with the analysis of IT. Okay? It is a very interesting case, the impact of IT on hospitals, because it is very different from what happened almost in any other context. Okay? Because beside the fact that we know that IT allows the development of new products, it requires the development of new technical skills, what traditionally has happened in most sectors is that the emergence of IT systems has called for a reorganization of the structure and is somehow employment displacing. Okay, this has not happened in hospitals, and we'll try to understand why. And the most comprehensive way in which hospitals as service and innovation providers can be analyzed is to consider not only the specificities of the core service, so providing medical care, but also the system which surrounds the specific service that you're providing. Okay? And this has to do with the idea that we do have a series of pre and post sale, if you want, services that are as important as the specific service that customers are paying for. Okay? So we'll try to go through these different approaches and trying to understand what actually can be derived in terms of innovation studies from the analysis of innovation in services. Very briefly on this. Aspetta. Scusami. Okay. So very briefly on this, hospitals as a production function. This is not extremely interesting from our perspective, but just to take into account this. Basically, this literature is very rough on this. Hospitals are seen as producers whose objective is to maximize profits and mobilize and combine production factors. Okay? The factors are understood as the medical care, okay? And the objective is to heal patients having, again, a profit maximization idea. What are the production factors? Well, you can actually describe the hospital activity in terms of production factors. You have capital, okay? Beds, diagnostic and therapeutic equipment, and so on. You have raw materials, in a way, which are drugs, okay? And this is also something that distinguishes hospitals from any other service we've seen so far. We, of course, have labor. This is a very important component. And then we have patients if we think that there is some sort of co-production or interaction between users and producers, okay? And this perspective focuses in particular on the existing of a technique, which is some combination of these factors for the objective of healing the patients, okay? And the fact that even if hospitals are public organizations, they are publicly funded, but they still have to respect the objective of maximizing profits, okay? Nothing really wrong with this besides the fact that this perspective neglects a whole set of social issues, not only social issues, but also a whole set of factors that are not included in the analysis, but of course that differentiates one firm from another, okay? Because seen from this particular perspective, you could actually try to reach the optimum in the combination of factors, and once you've decided that that's the optimum, then any hospital should actually follow the trajectory, okay? So the perspective is useful if you want to investigate the productivity of hospitals, but this is not the objective, of course, of these structures. More interesting is the approach that sees hospitals as a set of technological, on the one hand, and biopharmacological capacities. So the idea is that at some point the literature started realizing that you cannot really treat hospitals like any other productive firms, that hospitals have more than the traditional firms to say, both from a social perspective and also from an economic perspective, okay? And also innovations developed in this particular context, even if we think of technological innovation, are very distinctive with respect to other set of companies. So the studies have investigated the nature, the dynamics, and the impact of medical innovation. So this is very interesting because these studies try to characterize what medical innovations look like, okay? What is the cycle, if you want, of innovation? Okay, you know that there is a traditional product or innovation life cycle. We've seen Barras reverse life cycles, in particular for banks and insurance somehow, okay? And the impact in terms of employment generation, employment displacement, capital intensity, labor intensity activities, okay? What about medical innovations? How innovation works in this particular field? And when we think of medical innovation in this respect, we can distinguish three main types of innovation. The first is probably the most intuitive one, and is the development of new drugs. Okay? Now, I'm talking about hospital, and I'm talking about the development of innovation within the healthcare system. Some of you might say, yes, but new drugs are not really developed by hospitals, where they do sometimes provide innovation, but most of the time it's pharma companies or biotechnology companies that develop new drugs. Okay? Well, this happens very often in collaboration with research institutes. So besides the fact that the patent that is taken on some specific drugs or molecule is then assigned to the company, there is a really big process of collaboration between private companies in the pharmaceutical environment and laboratories at the hospital, so in the healthcare system. The second type of innovation is what we could call tangible medical innovation. Okay, so for example, the introduction of technical system for diagnosis or for therapy. Okay, so the idea that you can have some sort of machinery which introduces an innovation which speeds up, for example, the process of healing, or that helps getting more data about the patient in the pre-sale, let's say, service phase. Okay? And the third one, which is a very important innovation, and it's something that has been increasingly developed in most countries, especially in developed countries, is the so-called intangible medical innovation, treatment protocols. Okay? Now, let's go back to what you were mentioning before in terms of the main characteristics of hospitals or of health systems in general. Okay? Because I think that you all agree that users are less sensitive to prices. Right? If users are not very sensitive to prices, well, the outcome might be that companies are trying to provide very sophisticated and very customized type of services to users who are willing to pay for that, full stop. Okay? Problem is that, yes, users are less sensitive to prices, but since we are talking about medical treatment, about healing, this means that you have to provide a standard quality system for hospitals. Okay, yes?
They're very sensitive to time.
Yeah, of course.
So the balance, time, price, at the end, give the winning solution.
Yes, that's correct. If we see it from a private perspective, this is a problem, time sensitivity. So how do you solve this? Well, you increase the price of the service. I think this is the experience of all of us. Okay, so you say if you want to go in the public hospital, you can wait 6 months to have a radiology service. If you want to go to the private hospital, you can come tomorrow. Okay, pay 10 times and that's it. The problem is that if you want to analyze it from a social perspective, which is a more interesting, let's say, way of thinking of innovation in medical services, then we have to understand that the fact that users are less sensitive to prices does not mean that you can provide users with very low quality service, okay, in order to, for example, serve a market which is not willing to pay very much for any kind of reason. So the quality has to be very high in any case. Okay. And somehow, if we think of the type of services that we've analyzed so far, okay, users tend to be very price sensitive, and this means that the standard services are something that are going to be developed because competition is on prices, and that's it. This is a case where users are not sensitive to prices, but still you need standards. Okay, so there is the need for some sort of standardization innovation, if you want, even if users are not sensitive to prices. Okay, very important case, always in relation to what we've seen before. Okay? The development of treatment protocols, for example, goes in this direction. This is one of the most important organizational innovation and formalization innovation that has been developed in hospitals and in general in healthcare systems. We'll see some more continuing the discussion. And the idea is that even if you're not going to pay a high amount of money, you still need a quality for the service. Okay? And this is very different from any kind of service that we've investigated so far. So, nature of medical innovation. Think of a patient who goes into a hospital, okay, for any kind of problem. So the patient is ill, he has a particular disease, and he gets into the hospital, hopefully to get a service that allows him or her to be better. The types of technology, or if you want, of innovations that we can think of when considering hospitals are of very different nature. Okay? There is a whole set of non-technologies, so-called, or if you want, innovations that are not really technological, that are applied to very poorly understood diseases. Okay? And basically involve the assistance of the patients when the remission is basically impossible. So I know that I have a patient with a very serious disease. We're talking about the biomedical and pharmacological innovation type of analysis. I do not understand the disease. The drugs are not there. I do not know how to cope with the specificities of this new disease, for example. Okay? What I can provide is a service that has to do with the assistance of the patient in conditions where I cannot really try to remit the patient from the disease. Okay? The second and more interesting case, especially if we think in terms of frequency, is the so-called case of halfway technology. And the idea is that a patient has a disease. There are some technologies or some systems are developed in order to help the patient cope with the disease, okay, help the patient live to adapt somehow to a disease. Think, for example, of dialysis. This is probably the most common case. Organ transplantations as well, okay? But of course, these are all systems that do not really help getting into the source somehow or the causes of the disease, okay? They're just developed in order for the patient to live better. So the idea is that I want to be better off when I get into a hospital or when I receive and I buy somehow a service from these particular firms, okay? It is not always said that I can be completely healed, but the system of hospitals and the healthcare system in general has really invested very much in trying to develop technologies or treatment protocols that allow patients to live even in conditions, okay, which are not the best conditions for the patient. Finally, okay, still in the realm of medical innovation, so we're still talking about medical innovation, we have the so-called high technology. They really provide an understanding of the disease and, of course, are used either to prevent or to cure, to heal the diseases at low cost, let's put it in relative terms, lower cost, okay? So antibiotics and vaccines. The economic implication of companies developing innovation that prevent a disease or cure a disease are very different. So one thing is developing something, an innovation that is directed to the prevention of a disease, okay? The other thing is I have 1 million of patients that are dying, I need to cure them, I want to develop an antibiotic, of course, because people are already ill. What are the economic implications of this? Okay, also from a social perspective. So in terms of medical innovations, if you want, in terms of the most basic innovations that we can think of, still we need to distinguish very different innovations. Okay? And if we think of the sources of technology of innovation, this is the most standard one. Okay? So this is just the development of a new product that helps getting a better service. These two are more related to the realm of organizational innovation, if you want, or of a formalization innovation, okay, especially the halfway technology realm. So really we are talking about a very complex service. Developing something new has to do, even in the medical, specific medical field, with these three ideas, okay? So innovation are big even if we are talking about cases of non-technology. Okay. What about the dynamics? So this has to do with the nature of medical innovation. What about the dynamics of medical innovation? Okay. What do you think is the life cycle of a medical innovation? Is it short? Is it long? Think of the traditional life cycle. Let's not talk about Barras' reverse life cycle for a moment. So an innovation is introduced in the system. You can think of a new drug, or you can think of a new surgical procedures, for example. Does it last long or not?
I guess it depends. Like penicillin,
Okay.
I guess it has quite a long life cycle.
Okay, let's come to more recent times. I take your point.
Otherwise, you have drugs coming out. First for the famous first 20 years of patentability, and then after the 20 years, the life cycle just crashes down.
Okay. Achille.
I don't know exactly, but from the point of view of the pharmaceutical company, if they could increase the length of patents up to 100 years, they would do it, and they would pay each year for a patent. So probably life cycle is actually very long and very high.
Okay. So you still have in mind the drugs, let's say, field. Other, Rita, you want to say something?
Yeah, I wanted to say that for drugs it's long for the approval of patents and so on, but also I think that, for example, new machineries and so on, they are subject to the approval of, for example, in the US, regarding administration and development.
Okay. When we talk about life cycle, we're talking about the fact that an innovation is developed, okay, by different company, it diffuses in the market, and then it gets run away. So we're not looking at the pre-innovation phase, just to be clear. Okay. So a company patents, for example, drugs. What happens next? Okay. What do other companies do in that field? A new IT system for the, I don't know, recording of medical data is developed in the market. Okay. Is this a competitive environment, or just firms are happy with this? So this is the idea. Actually, if we looked especially at recent time, the life cycle of medical innovation tend to be very short and not very long. Okay. Why is this? Think of this type of innovation. Okay. So yes, for drugs we have the patents, and that of course fixes somehow the length of a life cycle. But for example, if we think of surgical procedures or investigations more in general, we have really a trend of replacement of invasive investigation with non-invasive procedures, of irradiating methods with non-irradiating methods, okay, with surgical procedures with therapeutic techniques, okay. I remember that when I was young, for example, long time ago, and you broke an arm or a leg, okay, you were basically lying in a bed for 3 months or something like this. Right now, they do not even fix your leg or your arm. They let, you know, the therapy work without really being invasive in that respect. And we can think of many examples of this type of innovations, okay, that have been developed more and more frequently. So the idea is that the first objective is I want to heal the patient. I need to find a cure for a specific disease or for something that happened to the patient. The second step is, okay, this particular cure has a set of side effects that I want to avoid. Okay, so besides the fact that drugs are subject to patents, we can try to develop other type of innovations that try to limit as much as they can the side effects of a specific procedure. Okay? Of course, this has the idea that we substitute some products or services with the new ones, but there might be complementarity across different services, especially when a new service or a new technique is developed and it's complementary with other type of services. In radiology, which is one of the most innovative sector of hospitals, scanners and very traditional radiological examinations are actually coexisting in the market. This has been an extremely innovative service, if you want, or product that helped the diagnosis of different types of diseases, but still traditional radiological examinations are there. Okay? And very often this is also due to costs, effectiveness. So being hospitals a public sort of services, of course, they also have to deal with costs. But still we can think of complementarity and substitution between different types of innovation. The impact, extremely important. So we're not talking about the development of a new tariff plan in the mobile communication sector, okay? We're not talking about the development of a new bundles of services in the touristic environment. So here the impact is really big, and this is why service in the healthcare and hospital has been really investigated. And the first reason why is that because medical innovation has a very big impact on health expenditures. Now, since in most cases we're talking about a public service, this is really a public concern. So this is an item on every policy agenda, okay, as much as we haven't seen in other cases of services. Okay? Generally, innovations tend to increase costs. So even if we think of the development of new IT systems, okay, the machinery is extremely expensive. The skills that need to be developed in order to be able to use that machinery effectively are extremely high, which again increases costs. So it is really difficult to think of an innovation in services that in healthcare services or medical services in general that is done with the purpose of decreasing costs, okay? Probably the electronic medical recording might be seen as such a type of innovation, but if we take all the innovations, okay, together, then really innovations tend to increase costs. So this is why this particular sector is interesting. But it's not all about expenditures, so we're not just interested in the public expenditure side of the market. Innovations have a big impact on the nature of work and competencies. Okay? Again, we're not talking about a banker who needs to understand how to use trading online in order to trade different type of items. Think of the development of non-invasive techniques. Okay? This implies that the doctors have to work with patients that are conscious. Okay? And this requires, you're smiling, but this requires a whole set of different competencies that are very different from what surgeons especially used to have. Okay? So I don't know if any of you knows doctors, I mean, as friends or have parents, relatives who are doctors, okay? But the stories that are told in the surgical room are quite interesting in that respect. Now, if the patients are conscious, okay, also from a psychological point of view, you really need to develop a whole set of different competencies, okay, which were not really required before. So patients are unconscious, you can do basically whatever you want. Now that's really an important thing, okay? Now there is a whole set of, protocols not only for the treatment of the diseases, but also for the operations themselves that need to be developed in order to provide a better service. So the idea is always that we need to heal patients, but also to provide a better service to patients that then might be willing to pay more for that particular service. And of course, there is a more general impact on the quality of healthcare services and on the well-being. Okay? Innovation increases the technical effectiveness. For example, reduction of mortality. So this is the main objective, and innovation are actually aimed at doing that in the first place. They might increase safety, the comfort for the patients, and they might improve the accessibility of healthcare. Okay? Day units or hospitals at home development are examples of innovations that increased somehow the accessibility of healthcare, especially in those countries where healthcare is not particularly easy to access, easy in the sense, of course, of prices. Okay? Just to give you a snapshot of probably the most important trend that we've seen in surgery over the last years, between 1997 and 2003. These are surgery with hospital stay, US data, and these are ambulatory surgery, okay, exactly for the same type of operation that was an eye operation, okay. 1987, they were more or less half and half. If you went back to 1980, that probably would be 100%. The development of medical innovation, both in terms of techniques and also in terms of drugs themselves, allowed the surgery with a hospital stay to decrease over time substantially, okay? Beside the fact that, of course, the total number of operations increased and the number of ambulatory surgery to increase substantially. Okay? Why is that possible? Well, for a number of reasons that have to do both with technological innovation, if you want, and also with the development of new competencies on the hospital side, on the provider side. Because in the end, the user is there, they can contribute to the production of the service, but after all, this is really a case where the users are passive in a way. Okay? So they want to be healed, they're not very price sensitive, they can provide feedback in a way, in the way in which they are treated, but of course they do not know anything about drugs, for example, very few things about the development of computerized systems and so on. Okay? So users are important, but they are important for social reasons other than, for the interaction with the providers. Now, let's come to the ICT. Think of the development of IT in different services. We've seen banks and insurance. We've seen mobile communication. Well, that's basically part of the ICT. We've seen touristic services. We've seen KIBS, okay, so the innovation and consulting companies. What about hospitals? What is the impact? Where ICT is actually important if we think of the healthcare services or of the hospitals? Where do we find IT? Yes?
Data management.
Okay, so the first one is data management. So what I was calling before, well, that's just an example, but it's probably the most relevant example, the electronic medical recording, the fact that you can move the user around, you can classify the users, you know the story of the users in terms of medical recording, so you don't need, again, to ask each time a user gets into a hospital, what about the previous diseases and so on and so forth. What else?
Well, just for blood donations, it's crazy how they keep track when you go and give blood, and if you're run out of the time of the 3 months you have to wait, they start sending you messages, SMS. Come back, give me blood.
Very interesting example. This would be a very interesting case to investigate. Data management, of course, are important for the users, but the electronic medical recording has an importance also for the providers themselves. So in the case that Sebastiano was mentioning, I mean, the persons who go there and donate blood are actually providers in some sense of raw materials, if we want to be neoclassical. Okay? And the idea is that the providers themselves can actually be subject to the ICT systems and somehow exploit the communication services that are available with the systems and other forms of interaction. Okay? Who else can benefit? Yeah.
There are a lot of innovations that we see regarding the communication inside the hospital between the various departments and between hospitals and the policy made, the ministry and regional council.
Between hospitals, so increasing communication between hospitals, units, and between hospitals and other actors outside, for example. Think of the emergency rooms management system, okay?
That's also trying to move the analysis from one step to another.
Exactly.
That means that if I have an exam in US hospital many times, the analysis is in India, for example, Indian doctors.
Yes. Very interesting observation. So there is an increase in communication among hospital units, so within the hospital and between hospitals and other organizations. And the communication is not only about specific data or whatever, but very often tackles the core of the service. So I can send a radiology out in India to be checked and then get it back to the US. Okay, so IT actually improves also the service, the core service provision. And of course, this is something. Yes, Sebastian.
Also, I don't know how close we get to the topic, but telemedicine is developing more and more.
Yes, and telemedicine, differently from what you've mentioned so far, is something that regards really the relationship between the users and the providers. For some reason, probably because we're used to think in this way, talking about IT, you really thought about how IT can improve somehow the management of the provider's organization, okay? Or the communication across different units within the company, let's put it like this. But of course, IT has an important role also in defining the relationship between users and providers in the provision and development of healthcare services. Telemedicine is probably the most advanced IT-based service we can think of, but all the scanners, for example, or the computerized analysis that has been developed over time is an example of how IT impacts on the relationship between providers and users. So there is a whole issue that refers to the role of ICT in administrations, in the management, in the organizational structure, if you want, of the hospital. So patient management systems, production input management systems, the case of blood donation, production unit management systems, so how different units communicate. But of course, there is an important role for IT also in actual medical care, okay? So hybrid technology which combines, for example, IT with traditional material processing, video surgery, okay? This is not as far as you think. Actually, it's already been implemented, and all the computer-assisted diagnosis, okay? And then ICT that facilitate remote service provision, for example, telemedicine. Okay, now of course it's very difficult to get a surgical operation via telemedicine. This is pretty obvious, and this means that you cannot really use IT to substitute completely the facilities and the labor of a hospital, as much as you can do in relative terms, at least for banks and insurance. Okay, but you can of course exploit in different ways both the internet and other software and hardware products in order to provide better services. So, information technology in hospitals and in healthcare systems in general can actually produce savings for the system. Okay? However, the costs of these systems are borne mostly by the service providers. So, although hospitals were born as a public organization and still healthcare service is a public good, okay, the most advanced innovation in the IT, if you want, area that are then applied to the hospitals are costly, and that cost is mostly borne by the providers themselves. For example, I was talking about EMR before. The use of EMR, the widespread use of EMR, electronic medical recording systems, can actually have significant savings for the system as a whole. Okay? However, how can you decide as a hospital that now tend to be managed as private organization to implement such a system? Okay? You need money, you need labor force in order to use that particular system. Not only that, but also you need some help on the outside. Okay, so the communication, for example, between units, between hospitals. What if a hospital has an electronic medical recording system and another one doesn't? Okay, and we go back to the standardization idea. So yes, users are not very sensitive to prices, but that's because of the characteristics of the service which is provided. But this does not mean that you can enforce different, very different level of services, although this is what actually we observe very often, just because some users can pay for that or are willing to pay, because very often it's a matter of willingness to pay, and others are not. Just to give you a snapshot of the savings. Okay. These unfortunately are US data. Of course, in US, hospitals are monitored much more because they tend to be private, and you know that there is a big debate right now. So this is the savings that are actually deriving from electronic medical recording. This is the share of costs that are actually borne by different organizations. Okay, so private payers basically, Medicare, which is a system, some sort of public system, and then state and local, the federal also borne some costs. Where do EMR actually provide most savings? Length of the stay, nursing time, drugs, and other different items. Yes, IT are important. They can realize some savings. Just to give you an idea of the implementation of IT in US hospitals, again, these are data from 2008, deriving from a survey of the major US hospitals. Of course, just 10% of US hospitals have implemented the full system of EMR, so we are still talking about a very basic IT system, although a very powerful one. 33% getting started and 27% low. So it is a phenomenon which is important, but it's not a very big phenomenon. The other interesting thing is that hospitals with high Medicare case loads are less likely to adopt health IT as well as a smaller hospital. Well, the size, of course, is very important in this respect. This is something that allows the exploitation of economies of scale, so no question about that, size matters. The Medicare is a sort of public system, private-public collaboration system in the US that allows some hospitals to get some public funds. And of course, if I have high Medicare case loads, I'm less likely to adopt health IT just because I have less efficiency pressure in my hospital. Now, this is on the provider side. Okay, let's look at the user. So this is Again, a survey which was conducted in 2008, still in the US. And this depicts the interest in online tools and other service provided by hospitals. Okay? Well, of course, you might imagine that the online access to medical records and test results, same-day appointment, online access to an integrated medical record are quite interesting services for consumers. The red bars are actually indicating consumers that have used that particular service. The yellow bars are users who are interested in. Well, if you're interested, okay. More interesting is the blue bar, which indicates consumers who are willing to pay extra for that, okay? And if you look at different type of services, you see a very different distribution in terms of interest in the user. So very basic service, yes. This is something that users are interested in. They might be willing to pay more, although they haven't used it very extensively. If we look at the bottom of the chart, so assistance from a patient billing representative, educational classes or meeting, assistance from a care coordinator, so all the, post-sale service, well, that's something that users evaluate less interesting as compared to other type of services. Okay? Still on hospitals and information systems, because I think that this is a very important issue, IT has a traditional characteristic, so it makes hospitals more efficient to some extent. However, the introduction of IT systems in hospitals had a relatively little impact in terms of reducing the volume of hospitals' job. So IT is not really employment displacing as much as we saw, for example, in banks and insurance and in tourism, okay, with travel agencies shutting down and with users actually using the systems without the help of the providers. Okay, here you need the provider, no question about that. Okay, you might try to automatize the communication with the provider. You might try to work on the data elaboration management part, but there is no way in which we can have a perfect substitution between an ICT system and the providers, the actual providers of medical treatment. In this sense, we say that IT is more complementing than substitution, it's substituting existing function and procedures, okay? And they actually draw the emergence of new career opportunities. It is correct to say that this went hand in hand also with the tendency towards the privatization of some hospitals, okay? So the observation that new career opportunities and new types of jobs emerge in hospitals has to do partially with the IT systems, partially with the fact that hospitals are more and more managed as private companies. So for example, they need a manager, okay? While before, this was not really needed, okay? But surely IT involved really the development of new competencies and new career opportunities, okay? Both on the technical side, think of all the radiology units, and also on the more social, psychological side, what we were saying before, okay? So IT makes it easier to deliver surgical operation, at least of minor importance, but then you have a whole set of competencies that are needed in order to assist the patient afterward, for example. And contrarily to many other service sectors, well, banking probably is the most relevant example, the pressure of working conditions seems to be relatively weak, even in presence of a big IT infrastructure, okay? So both banking, think also of the touristic services. I think that's also an interesting case in terms of impact of IT on that particular service. Here, people do not really risk to lose the job because the IT system is in place, okay? And hospitals are actually getting into a process of requalification of the existing personnel in order to exploit the new systems, okay? and this is because productivity in itself is not really the most important issue in hospitals. Okay? Other sectors, yes. In this particular sector, this is not the way in which users evaluate or the public sector evaluate the specific structure. Okay? Because in the end, the main purpose of innovation in services in the healthcare system is to improve patient health, okay, to heal patients, and not to reduce employment levels. So the idea, or better, to improve cost efficiency. So yes, if cost efficiency is improved, that's good news. We're not saying that cost efficiency objectives are bad, but bearing in mind that this is the most important objectives. So as much as in other type of public or social services, if you want, education would be another similar case, although again, with different characteristics. The main objective is not to maximize profit by increasing cost efficiency, but has to do with a more social, if you want, objective. Last thing that we describe is the idea that hospital services can actually be conceived as systems, okay? So the idea is that they can represent hubs of an entire healthcare system. Now, if you had to mention or to name the organization that somehow are related to the healthcare system, who would you think of besides hospitals? So we're talking about innovation in hospitals and in healthcare, but other than hospitals, who's involved in this type of system? In the healthcare provision. Okay, so the care of the elderly type of structures. Who else? Think really in terms of system of innovation. Okay, we do have hospitals, and that's probably where most of Medicare takes place. Who else? Care of the elderly, yes. Think simple. Pharmacies. Universities. Okay, and this has to do really with the core service, so provision of healthcare. Then we have a whole set of companies that are strictly linked to these particular companies, so providers of, let's say, capital goods more in general. Who else? Pharmaceutical companies, I would put them here. Okay, the state. Put it here. Who else? In the line of Eduardo's comment, if you had to build a hospital, to develop a hospital, of course you need physicians, so you need someone who came out of the university, hopefully. You need drugs, okay? You need some sort of pharmacy within the hospital. You need machineries.
Private
okay, the how are they called? General practitioners or something like this. I would put them also here. So someone who decided beside the emergency room case that you actually need to go to hospitals. And then there is a whole set of service providers, such as, for example, catering companies. Okay. Nurseries, and so on. okay? Psychologists, all this sort of type of providers. So we can really think of hospitals as a system hub, okay? Whereby we have the main services, which are the medical system, treatment, nursing care, and other type of services, such as, for example, catering, the administrative and managerial services, the paramedical services, retailing, okay? Then we have the mediums of service delivery. So we do have capital goods, so the material processing technologies. Think of the old robotics environment. We, of course, have the information processing technology. An example of this would be electronic medical recording. And then we have the knowledge. Okay, so we have, for example, diagnostic methods. We have competencies developed to help patients being better assisted after the surgical operation or during the surgical operation, and so on. Then we have the basic service characteristics. So again, let's exploit the framework that we've discussed at length during the course, okay, that are associated with the main services. Okay, so for example, the product range for retailing, the characteristics of the medical treatment. This has to do with the user's perspective. As much as we saw for other type of services, also in hospital, the service characteristics are those that users evaluate. So this is actually what users are confronted with, and are those that users sort of evaluate when they want to understand how much they're willing to pay for that. Okay? And finally, we have the competencies of the service providers, which are, of course, scientific and technical. Okay, so they have to do with the core service. They have to do with the development of material processing and information processing technologies. They can be external competencies in the case in which a specific hospital is in relation. Yes? About? Not yet.
Oh, I'm sorry.
Okay, so this is the whole set of competencies that we can find in hospitals. And if you want, and we stop here, you can really think of the hospital as a set of different characteristics, different competencies, and different functions that can be combined together in order to understand where does innovation take place. And we have a series of different trajectories that have to do with the specific characteristics which is changed in different environments, with the competencies that are acquired or dismissed. Okay, because, for example, a big trend right now is towards an increasing specialization of hospitals, which means that companies somehow dismiss competencies in order to get more and more specialized and more efficient in the provision of a specific medical treatment. Okay, and of course might have to do also with the surrounding services that are related to the core service, but that are important as well when we think of the service characteristics and of the willingness to pay of the specific users. Okay, so we stop here, and we see each other next Tuesday for the presentation.